First and foremost, we would like to hear from our Chief Product Officer, Mr. Incredible Henrik Schultz, and he'll tell us more about our fantastic Zinzino Ascent Oil, which the first bottle I'm holding there in my hands in Europe. And I'm really happy that Henrik is today with us, and he will tell us why actually the Ascent Oil is different from everything what we have in the market. And also he will teach us how to simply explain and understand or how unique is our Zinzino balance test. So welcome, Henrik, and please tell us this knowledge because everyone is waiting and really excited about everything you will explain for us today. Thank you very much for joining us.
Thank you very much for inviting me, and it's always a pleasure to be here, but at the same time I'm challenged to come after Paul, having already described everything in great detail. I learn every day by listening to Paul, so I'm also very grateful, Paul, for you taking the time. So fantastic. So I have the pleasure of working with Paul and Ida and Colin and Örjan and other people in the group of bringing products to the market, but merely coordinating what these great people are bringing on the table. So my job is a little bit now to perhaps explain a few things in a layman's word, to make it very simple, maybe not always 100% scientifically correct, but very easy to remember, I hope. So I'm going to share my screen. So first of all, I like to recognize that what we are talking about is prevention. It's always better to talk about prevention than a cure. Cure can sometimes be seen as a short-term thing. However, prevention should be something, a change you're doing for the rest of your life. And when we're talking about that, I'd like to focus on the omegas and then concluding more or less what Paul also said. They're all important, and it's omega-3, omega-6, omega-7, and omega-9. They're all important. And then we have olive oil, polyphenols, and olive oil that are important. So by achieving a good balance, like Paul said, it's a matter of having a good diet. And I can see from statistics and from reports and everywhere in the world, actually, that this is a challenge. And for most people, it means reducing omega-6s if possible and increasing omega-3. Some people are lucky enough to live on the West Coast where they are fishing and they can get wild caught fish. And then it's talking fatty fish, of course, which contains the most of the omega-3s. So what are you guys eating in India? I've done some research and looked at it. So first of all, there are, of course, fatty fish, and some of them are extremely popular in India. I've seen that from statistics, but not so many people are eating, and a lot of people are eating white fish, which is not the same source of the good omegas. And then I was checking out olive oil to see the goodness of the omega-9 and the important antioxidants we have, the polyphenols. And the statistics are saying that 70% of the consumption in India is palm oil and soybean oil. So probably not the best sources of great food for you guys either. What else do we know from India? Well, again, we can see that you have a younger and younger population, and soon the average age will be, below 30 years of age. And when I was Googling around, looking at what does the younger population like to eat, well, they like to eat frozen ready meals and fast food and so on. And I found that McCain was the leading company of supplying these fast food and frozen foods into the Indian market. And let's see what they are making. And they are making fantastic food. And that is super good, taste like, I don't know, but it's they are selling like crazy. So something good about it. And I would expect that these are also, like Paul mentioned, they are full of sugar, they're full of salt and full of saturated fat because that makes it taste so much better. Which is funny, which is the same in Europe. And when I read the guidelines from most countries in Europe, the authorities are recommending us to reduce the amount of sugar, salt, and saturated fat because it's not so good for us. But the industry is working in a different way. So when we then check from our side about the balance in the world, I've asked one of our other scientific members, Mr. Ola Eide, to look into the database, and he was looking at around 400,000 tests, and this was done in March. And we can see that the average person in the world has around 14.8 to 1 imbalance. And considering what I can read about the Indian food habits, you're not better off. And the few analyses we have from India shows sometimes enormous differences, like over 100 to 1 in balance. And of course, this is averages, as always in statistics. So it means that some people are lower and some people are over. But we can also see in the world, it's similar to India, that the younger population are for sure not eating better than the older generations. So what about people replying into our database that they've been taking a supplement? And then we can see that they are improving, but they are still in a pro-inflammatory mode. They are roughly 10 to 1 on average. And again, the younger guys and girls, they are not doing so good. And what we can see now is that they have improved by taking a pure fish oil or pure krill oil or a pure capsule with a pure fish omega-3 in it. But it's not good enough. They've reduced it a little bit, but they're still in a bad situation. So around in the world, there is something called Cochrane, and it's an organization with lots of famous and good professors and doctors in the world that are looking at other studies that scientists have done. And 2 years ago, they launched something that came on internet and in all the newspapers in Europe. Cochrane normally exists also in India. It's under reconstruction, I know that. But they looked at 79 different trials in the world with over 112,000 persons in it. And they concluded that the omega-3s that were supposed to do something good for your heart apparently had no effect. And this is, of course, very annoying if you're in the omega-3 business. We cannot argue with this. We can only agree with this. And if we look in India, what are the authorities saying? Well, FSSAI are stating omega-3, EPA and DHA, are very important for your heart, important for your brain, and important for your vision. These are the most common things that FSSAI are talking about. So they also think that omegas are important. So what happens when you are consuming a balanced oil? Well, we can see from the statistics that two things are changing, and this is scientifically very, very easy, but for some people it's sort of, how does it work? Well, when we look at the omega-3 content in your system, that's sort of one side of the coin, and on the other side we have the balance. You cannot have a good ratio of balance unless you have a large amount of omega-3 in your system. So that's how it works. So when you're imbalanced and have, let's say, 25 to 1 on the left side, well, then you have a very low amount of omega-3. And as you are consuming, for example, essential oil, which is in the rest of the world called balance oil, for all you guys from Europe and America listening. So as you are consuming it, you will increase the amount of omega-3 in your system. And then as a mathematical effect of it, your ratio, the omega-6 and omega-3 will lower. And you will end up in the green zone to the right. So it's quite simple. And this is how it should work. And when we check our statistics, we can see that people who have answered, yes, I have been consuming balanced oil or essential oil, as it's called in India, for 120 days, they have on average 2.8 to 1 in balance. So this is very promising. And these people are achieving the situation that Paul would like us to be in. So what's the difference? And sometimes we get questions like, so it must be the purest, best product in the world. It must be coming from fish that is happy when it dies. It must be fished in fantastic waters on the left or right side outside Iceland where we're producing the product. But it's not that. It's quite simple, and we tell the world about our secret. But they don't have a test, and they don't want to make a good product because it costs a bit more. But it's very simple. We mix fish oil and olive oil. And if you look at it, we have olive oil, olive polyphenols, the antioxidants that Paul talked about. We have omega-6, we have omega-3, omega-7, omega-9, and vitamin D. And if you compare that with a pure omega-3 product, you can see the difference. And that's why our product works and the other ones are having problem. And it doesn't really matter if you try to take the other product in double dose or triple dose or quadruple dose. We've tested, it doesn't work. So that's why we have this product that actually do work, and we have the test. So what else can we tell about the secrets? Well, it's mainly fish oil coming from anchovies. Sometimes also a bit of mackerel, and sometimes also sardines. Anchovies are quite good because then we also get the omega-7. And it's fished out in the oceans. We are not particularly concerned if it's on the left or right side of an island. We are concerned about it comes from sustainable fishing areas approved by Friend of the Sea, where we are members, and the whole team of companies in our group, we are members. And by knowing this, we also know that it's a good quality oil. It's according to our specification. We are very selective in the amount of omegas we would like it to have. And then we are also getting an olive oil from Spain in the Andalusia region. It's called Picual. It's very peppery, but it has high contents of antioxidants, the polyphenols. And it's harvested roughly a month before the normal harvesting period because then it's got extra high content. Then the stone is taken out, it's cold pressed, and then there is an extra virgin olive oil. Stored in large tanks with nitrogen on top, so it stays fresh. And on average, we are having 750 milligram per kilo, and the normal extra virgin olive oil you can find in the supermarket perhaps contains 100 milligram per kilo. There are different sorts, but on average. So there is a huge content of it. And as Paul mentioned, there are many good things about the olive oil, the oleic acid, and all the other phytonutrients you can find in it. But the main thing is to have the antioxidant to protect the omega from oxidation from the mouth all the way into the small intestine where it's taken up and into the cell membrane in an easy way to remember. So there are more details as Paul talked about, but to make it simple. And therefore we have a dosage systems that say you should consume roughly 0.15 milliliter per kilo body weight. So if your weight is 100 kilo, then it's 50 milliliters per day. And when we say per day, it means every day. And you should consume this roughly for 120 days. And then you can check your test again and see where you are at. And just to mention it, that some people are not that sort of rigorous. They take it more or less every day and more or less the correct dosage. And surprise, surprise, when they check the test after 120 days, they don't get the full effect. And they contact Cincino office, and then we ask them these questions. And the conclusion is if you take it more or less every day, more or less in a correct dosage, that's why you have more or less a good result. So it's really a choice what you want to have. Now, all these products that we're using, both the fish oil, the olive oil, and the ready product, is analyzed several times per year. And it comes with all kinds of certificates to make sure we are free from heavy metals, from PCBs, from toxins. The olive oil is free from pesticides and fertilizers and other things, because we want to know and make sure that every ingredient in our product is safe. And these documents, they are checked by various authorities when we try to register our products. They are checked on a regular basis when they do checkups on how Cincino are doing. For example, in Sweden, they check PCBs and all those things once a year. So we need to show them 3 analyses that is done over the year, and they do this year after year after year. So we have a fantastic product, safe to use, that do get you into balance and get you where you want to be. Now, if I would do something that is absolutely not 100% scientific, but very easy to remember, I expect Paul to jump off his chair, but let's see what happens. So I would use this perhaps to show you why it works. And this is very simple. And again, not 100% scientifically correct, but, and a fish, if I'm correct, that's an Indian rohu full of omega-3. So when you're consuming that, you're consuming omega-3, but also other omegas, and you're consuming vitamins, and it's antioxidants in a way you could say, that is bound in the fish and together with the oil and omegas. So if you eat this a lot of times per week in fairly good proportions, then you will get in balance and you don't need a supplement. So the fish is not the problem. The problem is that you're not eating it and not large enough. But by eating this fish, you will reach the omega-3 situation and the balances you want to. But if you just take out one piece of the puzzle, the omega-3s, and you leave all the other things behind in the fish, that's when it doesn't work anymore. So in a way, you could say what we're doing is replicating the fish. So we have a balanced product, the Essent oil, where you have all the different kinds of omegas, and you have the important polyphenols, the antioxidants, and you also have olive oil and oleic acid from it. And by having this, it works. So it's similar to a fish. Very easy to explain, not 100% scientifically correct. So if we summarize it then, so the Essent oil in India, what is it and where are we? Well, you could say it compensates for the processed food and the eating habits you have and we have. It's very good for your intestine. I mean, polyphenols are very good for your gut health. It's good for your immune system, and it contains vitamin D, so that's also very good for it. And as Fasai says, it's good for your brain, it's good for your heart. And Paul talked about the inflammation processes. So when you're bringing your omega-6s and omega-3 in balance, we're doing something there. And all in all, we have a prevention situation, which is so much better than a cure. And you need to take it or change your diet for the rest of your life. And you see, after 120 days, you have replaced all your blood cells, and they are then showing what you've been eating for 120 days. If you then would stop taking the product, then after another 120 days, you have got new blood cells again, so you're back where you started. And that was no point of doing. So getting into the mode, understanding what Paul talked about, understanding that this is a change for the rest of your life, one way or the other. Now, for checking this, we have a website, cincinotest.com, and there we have the world's largest database of fatty acids. So I've had the possibility to work with doctors since the early 90s. I was part of a company where we're doing clinical trials on wound care. And if we could gather, 100 persons or 500 persons sometimes in a test, that was enormous. So when we are showing somebody that we have close to 600,000 tests now, that is a massive database that any scientist would like to get their hands on. And it's just fantastic in that respect. And it's growing rapidly all the time. So once you've taken the test, we are cooperating with a company called Vitas in Norway, probably one of the most sophisticated laboratories in Europe. They have all the important equipment that you need, and they are expanding as we are growing. So we don't have an issue there. In fact, we are a good customer, but we are not the sole customer. They're operating with universities and hospitals and lots of pharmaceutical companies, and are experts in so-called dried blood spot test analysis, doing probably 60 or 7 different biomarkers for various companies and universities. And what happens once you've taken the test? Well, they're actually punching out a small circle, putting that into a vial with some liquid, and then into something called a gas chromatograph. And out of that, there is a gas chromatogram coming out. And you see the spikes coming out for various fatty acids. And if I simplify that even more, you can see the 11 fatty acids. And what we are doing is not actually measuring the milliliters or gram or whatever you might be thinking of. We are measuring the percentage. So we are calculating the areas of these fatty acids, and then we set them to be 100%. And then we look at each fatty acid, what's the percentage out of those 100? And this is one of the common questions we get at the office, what we are measuring. So we're measuring how much EPA percent you have out of the total 11 fatty acids that we are measuring. And in terms of the samples, we like to have good quality. But in several cases, even if there is a small blood sample, we can still analyze it because we are measuring what it is out of the 100%. So if we have a not so good blood sample, then still it's going to be 100%, and then we can measure it. So this is an example from the Vitas laboratory where they are showing that still the same analysis, but 2 different blood drops, and they can see the relationship is 3:1. So there are a few do's and don'ts that you need to remember and to mention that. So we are measuring, or Vitas are measuring fatty acids. And we don't want any hand cream to come with the blood drop into on the filter paper. So please make sure that you wash your hands with soap and warm water before taking the test. And anybody who touched the glass and then looked at it knows that there will be fingerprints, and that's because you have some fat on your fingers. So don't even think of touching the paper. This is a big, big no-no. So wash your hands and don't touch the paper. Prick your finger, have a blood drop dripping onto the filter paper, but don't touch it. Another thing worth mentioning is that once you take the test, you leave the card for some time, then put it back into the paper sleeve and then into a metal pouch that we have. You close it properly. Don't leave it open. And there is a small drying bag also inside the pouch. That one must remain there also to ensure we have a good quality test. So we also have a website. So I thought of changing and moving to the website instead. So if I share my screen like this, it should be here, right? No, sorry. Where are we? Just one second.
One.
Yes. That was strange. It's always, it should always be a little bit surprising.
Yeah.
But bear with me. I will be there shortly.
Well, while Henrik is looking, what do you think, Andrew? Will we be doing well in India?
I think we'll be doing well. We had nearly 500 participants there, so it's really great. And I have a dream that together with our chief sales officer, who can a bit step in also, Mukesh Malhotra, we can really do great things together with all the team. And my dream is to get to empty the warehouse in 2 weeks after we start. So I hope that all the teams will be together and we'll empty that in 2 weeks. And since we're already producing, I think the next batch, they will be produced next batch soon. So we'll have everything in place in a couple of weeks. So I think that everyone is really happy about what's happening right now. We are starting the training before the opening. So I'm really happy about everything.
Well, that's exciting. Just let us know when you're ready, Henrik, and we'll give the word back to you.
Thank you. I'm ready now. So we hope you log on to cincinotest.com, where we have our new website. and it should show you the language based on your IP address. Otherwise, you can choose which one that is most convenient to you in terms of language. So what we are doing is showing you, as you scroll down, that we do have the world's largest database. Now, since this is on Zoom, the video is now working a little bit, but not perfect. But we have a video that shows you how to take the test, where to, and so on in a simple way. So you could send anybody onto the website so they learn how to do it even before they signed up to be a partner or a customer. There are no secrets here. As you scroll down, we show you and anybody that is a mobile first version on our test site. And if it works fine on a mobile, it works on tablets and on laptops also, of course. And there is an in-depth knowledge where you get more results and you can track your progress. As you send scrolling down, people can see exactly how you can take the test, and you can click on some lines, get more information like the instructions of use if you want to see that. We will change this picture a little bit later on, so it says not balance oil, but essential oil when you come from India. And you can learn more about the products. You can see wait for the analysis, and if you, for example, click here, we can then show you that, okay, so it's about Vitas, who are they? And you can read what they do and don't do. And there are some PDFs you can download so you can feel safe and secure about how they are treating the samples, both during analysis and afterwards. You should get your results and you should retest your levels after 120 days. So this gives anybody a clear view of how it works. So if you're new to it, this is where you go to learn everything about it. As you scroll down, you can then see more, learn more about how the testing, but also what are we analyzing. So we talk about the 120 days, the 11 fatty acids, and then we mention which fatty acids it is, right? And then what calculations are we doing? Well, then again, no secret, 11 fatty acids, and they equal 100%. And we are calculating 6 values or indicators. And for this, we use 7 of the fatty acids. And what are we then showing? Well, first of all, we have something called a protection value that goes from 0 up to 100. And if I would make it super simple, we have Professor Harris from America, Mr. Omega. He came out with an omega-3 index. And if you have more than 8% in your blood, then he considers you to be minimizing the risk of getting a cardiovascular disease. Whereas if you're below 4%, you are putting yourself at risk. So he's got 1/3 of the protection value. We got another doctor in America called Lance. He made his own omega-6 free balance where he uses all the fatty acids. And his balance value is 1/3 of the index. And then you have the normal omega-6 free index that we are using with arachidonic acid and EPA, and that is 1/3 of it. So you could say we have 3 professors in the world, and they have a vote, 1/3 each, and collectively that sums up to the points of protection value. But if your EPA specifically is very low, then you might end up having 5% or 10% or even 0 in protection value. But don't worry, when you increase your omega-3, something will happen with it in a good way. We have the omega-3 index, and we tell you what it is. It's a sum of EPA and DHA. We have the balance, and we'll show you also here that it is the equation of dividing arachidonic acid percentage with the EPA percentage. Then we have cell membrane fluidity, the cell membrane Paul talked about, and we also have mental strength that we're measuring. So let me just point out, we are not through the DBS measuring the membrane fluidity as such, and we're not measuring the mental strength as such. But from the science, we know what is an optimal situation of the fatty acids that is then making an optimal situation in the cell membrane. So when we find this optimal situation in the blood cell, we can then say, therefore, it is the same in the cell. And the same goes with your brain. We know that the brain is made of DHA and the EPA and needs both of these fatty acids, well, all fatty acids, to function properly. And when we have a good fatty acid composition that is similar to what the brain would like to be in, then we can draw the conclusion that we have a good mental strength situation. And as Paul mentioned, we need the omega-6s to start the inflammation processes, and therefore we have the omega-6 arachidonic acid index, because you need some, but you don't need too much. So we have a graph showing if you're in the middle. Now, if I then click on the results, and I prepared it a little bit because it takes some time while it's calculated, we have chosen this time to show you clearly that this person is unbalanced and protection value is 0 because of low values of omega-3. Index is 2.6, not very good. It should be above 8%. And the only thing that is really good is the arachidonic, the omega-6 index. You can click on this and come down on, but you can also scroll. And then we show you with a bar where you are on the balance. And if you see a plus sign, it means you can click on it and read more about both the dietary advice and the way we calculate. So you don't need to go back on the first page. And we can then see, protection value, omega-3 index, mental strength, and so on, and arachidonic acid. Then what we have also is that is quite interesting is the panel of all the 11 fatty acids. And I mentioned we don't measure gram or milliliters, we measure in percentages. And this percentage calculations can sometimes for some people be a bit challenging. So I'll try to explain it as good as I can. Again, you can see the plus sign so you can read about palmitic acid or oleic acid and so on. If I then scroll down to the omega-3s, and let's look at, for example, EPA. So the target value, which is where most of the people are if they are in balance according to our statistics. So this is, if you want to be as good as the balanced people, this is where you should aim to be. This person has only 0.55 in EPA, and this explains to me why the protection value is so low. Now, the deviation is 3.8 percentage units. Some people might say, not too bad. Well, if we're measuring is a difference in percentages, percent, then it's 87% almost. And that's why we have this fourth column. So if you were thinking about it would be kilos or gram instead, you could say, so the target is 4.13 units, and my result is 0.55 units, and the deviation is 3.58 units. But the difference in percent is almost 87. You understand how far away this person is. So everywhere you can click and learn more. And if you add another test by clicking, then you can also add and see how you progress. Now, if you would like to have it all on a piece of paper, you can download a report and you get a PDF, either with just the information about your results, or you can download a larger one with all the information and all the text. But I leave that for you to try out. You can also click on the various links, and you can see this is a male 53 years old, so on and so on. And you can also have the links and downloads from the top menu, and you get PDFs and you get more information. So what I would urge you guys to do as my final comment is to go on the webpage, surf around, be an expert on where the information is, learn as much as you can. Don't be afraid. You don't need to know and understand everything. But if you, for a new person, can explain where the information is and it's readable and accessible, then you've done more than most people are doing at the moment. So by doing that, I thank you for listening and hope I've shared some information that is of value for you. Thank you very much.